If you weren't aware that your gut microbiome is connected to PCOS, then this video is for you. Welcome to part 2 of our series on hormone metabolism and the microbiome. Our first part focused on endometriosis. In part 3, we'll focus on beta-glucuronidase. But for now, let's highlight the connection between gut health and PCOS. And by the way, you'll see some similarities to endometriosis. If you're new, be sure to subscribe to my YouTube channel and also follow me on Instagram and Facebook as The Microbiome Expert. It's outside the scope of this presentation to get into the hormones at play in PCOS. This discussion is from the perspective of the microbiome as a driving force behind the condition. In addition, those with PCOS are probably well aware of the basics and understand the connection to hormone imbalance and a lack of or infrequent ovulation, the facial hair and acne that may accompany higher levels of testosterone, and impaired fertility. PCOS derives its name from the cysts that form from the failure of follicles to ovulate, and 8 to 13% of women of reproductive age suffer from PCOS, no small number. And given its strong connection to metabolic syndrome, women with PCOS have higher risks of type 2 diabetes, NAFLD, and cardiovascular disease. But how is the gut microbiome connected? This paper talks about the importance of gut barrier integrity, and if it's compromised, that the LPS I'm always talking about can escape, resulting in persistent systemic inflammation, which has been highly correlated with insulin resistance, which is one of the core concerns in PCOS. I talk about this much more in this video. From this confusing figure, we touch on some of the basics we just highlighted. In the center, we have the gut microbiota. If in a healthy balance, it produces plenty of short-chain fatty acids, the most important being butyrate. The gut barrier is maintained, i.e. a lack of gut permeability, and the bad guys, aka opportunistic pathogens, are kept in check. You have to understand that these opportunistic pathogens are a part of the normal microbiome, and given their name, when given an opportunity, they will become pathogenic. How so? The number one culprit is excessive antibiotic use. But excessive PPI use, a poor diet, stress, alcoholism, and more can drive dysbiosis. With this abundance of pro-inflammatory agents, the best example being LPS, the dumping from the gut via the portal vein affects the liver, hence our NAFLD from earlier, something I talk about in detail in this video. The leakage via gut permeability, aka leaky gut, also can impact vascular health, touched on here. And when the bad guys are in charge, there is a lack of butyrate, some of which is systemic and has amazing benefits for the body, to include those related to metabolic syndrome. With all this in mind, these authors reviewed 31 studies looking at the connection between diet, the microbiome, gut permeability, and the effects of LPS leakage into circulation on pathways such as the connection between insulin and testosterone. They conclude with this statement, which you can read, which reinforces what we've been talking about and what we will continue with. Here are the two main references they included. These both touch on the role of diet, LPS, insulin resistance, and immune activation, i.e. inflammation. For much more information on leaky gut, aka gut permeability, feel free to watch this video, which is key to understanding how a dysbiotic microbiome affects you systemically. We're going to take just 2 studies from their review and dive in a little deeper to help understand what's going on. In this first PCOS paper, we have subjects who also have metabolic syndrome, for the obvious reason that it's so prevalent in PCOS. You can see clear correlations for measures of the number of menstrual cycles with adiposity, insulin resistance, insulin sensitivity, and zonulin. Zonulin I talk about on occasion in terms of gut permeability. The more zonulin, the more permeability. Here we see an inverse correlation. The more zonulin, the fewer the menstrual cycles. So we see a clear correlation between menstrual dysfunction and gut permeability, i.e. dysbiosis. And here we have a study in women with PCOS looking at something called LBP, LPS binding protein. The job of LBP is to bind and present LPS to additional components of the immune system for targeting and elimination. In other words, it's an indirect measure for LPS. They found that, compared with controls, PCOS subjects had a significantly higher LBP concentration. In other words, PCOS subjects had more LPS in circulation, because these are serum levels we're talking about. And this LPS came from where? The gut. Now, point of note, we all have bacteria and parts of bacteria in our blood, much from the gut, some from the skin, some from the oral microbiome, etc. The question is, how much bacterial DNA and what is the composition? An unhealthy gut will drive blood levels with more bacterial DNA in total, and that burden will be more pro-inflammatory, and will thus drive an immune system which is hypervigilant, because it's always in alert and attack mode, leading to things like food intolerance and autoimmune disease. See these videos for much more. These authors cite the connection between LPS, inflammation, and insulin resistance, which, by the way, has a staggering estimated prevalence in PCOS of 50 to 80%. With the connection of gut health and PCOS in mind, these researchers looked at a very common gut condition, IBS, irritable bowel syndrome, and conducted a meta-analysis to correlate PCOS with IBS occurrence. They found that those with PCOS had over 2 times the risk of having IBS. So, which taxa, bacteria, are we concerned about? Well, here, and this may surprise you if you're new to my videos, they talk about your so-called probiotic lactobacillus being potentially harmful and abundant in IBS and PCOS. This chart comes from my huge meta-analysis of all human fecal microbiome studies I could find looking at the bacterial differences between those with IBS and healthy controls. You can learn much more about IBS in this video. We can see an abundance of classic bad guys like Ehrlichia, E. coli, R. navis, Streptococcus, Veillonella, and yes, Lactobacillus in orange. Whereas in IBS subjects, they have significantly less health promoters like F. prausnitzii, Odoribacter, and Allostipes. So how does this IBS microbial fingerprint match up with some PCOS microbiome studies? I hope you're enjoying the video so far. Don't forget to like, subscribe, and recommend to friends and family. Also, if you're feeling extra generous, hit the super thanks below. Here we have an extensive meta-analysis which looked at just that. I know you can't read the table, but I'll summarize and highlight 2 taxa. You can also get this paper or any other paper I present and read it for yourself. Now, as usual, the complex world of the microbiome does not yield perfectly uniform data. We have to look at these things with a trained eye. With that said, the 2 most consistent taxa from this meta-analysis of 28 studies were E. coli, the poster child of opportunistic pathogens in the gut microbiome, and Lactobacillus, both consistently higher in the microbiomes of those with PCOS versus healthy controls. So when it comes to those probiotics, which are always marketed to you, why would you want to put more Lactobacillus into a high Lactobacillus environment? You don't. I talk about this extensively in these videos. Instead, let's try something more intelligent. Let's feed those butyrate-producing good guys who are decreased so they can take charge of the microbiome and create a healthy environment. For example, here's one of those studies from that meta-analysis. Here you can see significantly higher levels of E. coli in the microbiomes of those with PCOS versus healthy controls. And here's another one of those papers where in C you can see significantly higher levels of Lactobacillus in those with PCOS versus healthy controls. You can also see significantly lower levels of butyrate producers from the amazing genus Roseburia in those with PCOS. Again, this imbalance is from various lifestyle factors, such as antibiotics, diet, and more. And here is a third study used in that meta-analysis. But this time, instead of looking at the bacteria, we'll look at figure B. This line separates the PCOS subjects on top from the healthy controls on the bottom. Do you see any clear color patterns which differ between the two groups? Here we see a huge positive correlation between testosterone and PCOS. In other words, those with PCOS have significantly higher testosterone levels than healthy controls. We see the same here with luteinizing hormone, which is also a classic finding in PCOS. And we see higher BMI, weight, in those with PCOS, tying back to obesity and metabolic syndrome from earlier. And here is a study I found which was published later, therefore not included in that previous meta-analysis. What do we see here? In Table 1, we see significant differences between PCOS subjects and healthy controls when it comes to facial hair, acne, testosterone, insulin, and glucose, all lining up with what we've discussed. And to the right, we see more inflammation as designated by TNF-alpha, more LBP, which we talked about earlier, signifying more LPS escaping the gut due to too many LPS-containing bad bugs in charge of the microbiome, and more D-lactate, signifying a high-lactate environment, as in lactobacillus, which I discuss often, which is why you don't want to introduce fermented foods either, as you'll just be contributing to more lactate, D-lactate included, which can be neurotoxic. There is good news. The metabolic, reproductive, and phenotypic features of PCOS are modifiable and reversible in most women with PCOS by implementing lifestyle-based interventions, regardless of the pathophysiological mechanisms involved. If not probiotics in fermented foods, then what? Here we see dietary fiber intake is significantly lower in those with PCOS, and they discuss its connection to the microbiome, which is my #1 theme in my many videos, and my primary philosophy. We need to feed the good bacteria who have been sidelined by lifestyle factors, so they can take control of the microbiome and in turn sideline the bad actors who are driving inflammation. Now, I know what you're going to say, at least some of you, that you eat a healthy diet and exercise and can't lose weight and fix your gut. I've heard this a million times. For one, inflammation is tied to weight gain, so it's very hard to lose weight when you're inflamed. And if the microbiome is the primary source of your inflammation, a healthy diet may not do the trick. First, your definition of healthy is probably different from mine. Second, when the microbiome has taken a number of hits, it needs extra help to turn that ship around, which is why I work with properly blended and dosed prebiotics suited to the needs of the individual, along with other ancillary supplements to help address immune dysregulation, bile acid dysmetabolism, and in this case, hormone dysmetabolism, among other things. As we address your microbiome, we'll resolve inflammation, and with a proper diet, the weight should come off and your metabolic syndrome improve. And if you're having fertility problems due to your PCOS, doesn't this sound easier, healthier, and a lot cheaper and more comprehensive than fertility treatment? I invite you to watch the other videos I referenced here, and if you so decide, purchase my PCOS protocol or schedule a consultation with me for something more personalized. And to help make your life a little easier, in case you haven't heard, I recently created an account with a distributor, FullScript, for US customers only, which allows for easier and less confusing product fulfillment for my protocols, as well as a 10 to 15% savings on the supplements I recommend, as well as any other health products you may use. If you liked the video, don't forget to subscribe. Also, somewhere around here, you can go to my website where you can schedule a consultation with me. You can also view the protocols, and here you can watch the next video.